I'm Brian Jacobs. I'm a nurse anesthetist in the pain clinic here at Manning Regional Healthcare Center. I started my practice in clinical anesthesia, performing anesthesia and pain procedures prior to surgery. I then went back and completed a fellowship in the management of chronic pain, and now operate pain clinic here at Manning, performing interventional pain management, so things like injections to help in the management of neck and back pain, as well as prescribing medications and other complementary therapies to help people with their chronically painful problems.
When you arrive for your pain clinic consultation, we'll bring you into one of our patient recovery rooms and we'll review your medical history and your medications, and then Brian will see you.
So most typically we see people who are complaining about chronic neck and back pain. Those are probably the most common pain complaints we've seen. But we also see patients who complain of chronically painful headaches, joint pains, abdominal pains, and other types of pain syndromes that usually persist for several months or years even. And so to help patients manage their pain, we usually do a combination of therapies. Most typically that includes some form of physical therapy to help strengthen their back, strengthen the muscles around their joints, as well as things like injections into the neck or back. There are a lot of different structures in the spine. The spine's a very complex anatomic unit, and so different structures cause different types of pain. And so the most important thing we do is pinpointing the primary source of the pain and treating where it's coming from. So once we've determined where a patient's pain is coming from, and we've determined that an injection is the right thing to do in terms of helping them manage that type of pain, we'll bring them back to our procedure suite. There we make sure that they are in a safe and comfortable position for whatever procedure we're doing. So for example, if we're working on the low back, we usually have the patient lay on their stomach, ensure they're comfortable prior to cleaning off the back with a couple different types of antiseptic solutions. We then use X-ray to find the target of interest. Most people are familiar with things like an epidural injection. We use the X-ray to help guide the needle into the epidural space to be able to perform the injection safely. The X-ray allows us to assure that we're in the right space with the use of a dye or a contrast agent. And then we go ahead and deliver the therapeutic solution, which is usually some combination of a steroid and a numbing medication. After the procedure is over, we clean the patient's back off, apply a bandage, and then ensure that they can move safely prior to discharge. Most typically and ideally, we give the patient an injection, and the relief they appreciate from that injection lasts several months, even up to 6 or 8 months, and we don't have to see them for follow-up until their pain returns. Although there's a lot of variability in that. So some patients get one injection and they never need another one, which is great. Some patients might get injections more frequently, such as every 3 to 4 months. There are some procedures we perform, such as ablation, where the expected duration of relief is much longer, anywhere from 6 months to a couple years. And that is certainly common in our practice, that we have patients who we haven't seen in 2 or 3 years, who had an injection with us previously. Their pain has returned, and they come to us seeking reevaluation and possibly getting another injection. So different types of treatment we typically offer in our pain clinic. Again, first and foremost, we partner with several other services. Pain is not just one thing. The pain experience encompasses what we call nociception, or a physical pain, as well as influences of pain that are not biological. So things like social factors, psychological factors, all those things need to be addressed when we're talking about the treatment of pain. And so accordingly, we use other complementary services in the management of pain. While most typically that includes physical therapy and rehabilitation, we also utilize the services of occupational therapy, working with counselors, psychologists, and then services that people are more familiar with, such as neurology, orthopedics, surgeons certainly. The pain has to be managed in a multifaceted, multimodal, what we call, approach. And so while we do perform things like injective therapies to help patients with their pain, we're also prescribing medications, prescribing psychological therapies and physical therapies as well. So there are a couple ways to get a pain clinic appointment. Most patients are referred by their family practice provider or another specialty provider, such as an orthopedist or neurologic surgeon. Patients are also welcome to book appointments with us directly.
Manning Regional Healthcare Center, your trusted experts close to home.